And welcome back. Time for this week's Capitol Report with Pat McGuigan of CapitolBeatOK.com. Pat, the Surgery Center of Oklahoma making news again, this time for a perhaps revolutionary agreement with Oklahoma County government. You reported on this for watchdog.org. Share your insights on this.
It's really a national story because as far as I can figure out, if it's not the first, it's got to be among the first. I haven't found a single other example of what Surgery Center and Oklahoma County have done together. They've signed an agreement that takes the Surgery Center's guaranteed upfront pricing, which we've talked about before, which is 1/10 to 1/3 as much as in the big hospital, big Medicare, big Medicaid, big insurance system. And guarantees, the quality and everything else about those procedures at the surgery center for a fraction of the cost. Bottom line, we're talking 3 or 4 weeks, and the cost to the handful of county employees who have availed themselves of these procedures, I'm talking about county government employees now, through their insurance program, have been able to get these procedures for $140,000 total less, like $58,000 versus $200,000. They're projected to save hundreds of thousands of dollars over the course of the year, and of course eventually, over the course of a decade, be millions for very common kinds of procedures of the sort done at surgery centers. But this is the Surgery Center of Oklahoma, which has been taking on mythical and larger-than-life proportions because of the impact of their price transparency, their effectiveness, and the lower costs, and for that matter, even the charitable work that they do. It's very interesting. You've got national experts like Devin Herrick at the National Council of for Policy Analysis out of Texas, Catherine Hempstead of the Robert Woods Johnson Foundation, which is, speaking of mythical proportions,
right,
one of the biggest players in the country on healthcare analysis, Taryn Bragdon at the Foundation for Government Accountability. All of these national figures and analysts are praising what the county and the Surgery Center have done. The local players, of course, are Dr. Keith Smith, who's the co-founder of the center, Jon Wilkerson, the benefits manager at the county government, who people are joking about him walking around with a Superman suit on because at a time that you need to be saving money, they came up with a way to save money. And finally, Jonathan Small at the Oklahoma Council of Public Affairs, he's saying, why don't we do this in state government? And it's the kind of thing he's been advocating for a long time, very much building on the kinds of things he's been pointing out ever since he worked for Kim Holland several years ago. So it's pretty exciting. It's a big story, and we'll watch it unfold to see if price transparency, upfront pricing, lower cost, high quality can still be delivered in American healthcare, and it looks to me like it can.
All right. A Democrat has entered the race for Senator Coburn's seat, 2 years left in his term. State Senator Connie Johnson, an African-American from Oklahoma City. Do you think she has a chance against a Republican?
I asked her that question in a different way. I said, can a blue gal win in a red state? And she smiled and gave a very nice answer. She has a lot of sympathy for working people. She's very focused on the high rates of incarceration, and frankly, that's an area of agreement that I have with her. High rates of incarceration of women for nonviolent offenses and seeking alternatives to that. She said that in her campaign she'll speak for Democrats, Republicans, progressives, libertarians, conservatives, people who have been left out. She supports the immigration bill, the bipartisan immigration bill now pending in the Congress. She told reporters she didn't think race would be an issue, and in fact, it absolutely won't be an issue if it winds up being her and T.W. Shannon. But I don't think it'll be an issue if it's her versus James Lankford. I think it'll be conservative versus liberal. So you'd have to say it's a long shot for her. I think in part her advocacy of medical marijuana and lessening the penalties for possession of marijuana, it's an idea that if the time has not come, it may be coming. And she's advocated that for a long time. She's been totally consistent. I think Johnson is, when she's on her game, pretty impressive. It gives voters a choice. and that's what politics and elections are about. So I salute her
nice.
for running.
Absolutely. All right, well, you can read more about these and other topics at CapitolBeatOK.com. For Pat McGuigan, I'm Alex Cameron. Have a great day.